Hello, I'm Dr. Shivani Chandan, consultant obstetrician and gynecologist at Aster RV Hospital, Bangalore. There are a lot of myths surrounding the care following cesarean section. A lot of patients have a lot of apprehension. They do not know what is to be done, what is not to be done, and what are the precautions to be followed after a cesarean section. So that is what I'm going to cover in this video. First and foremost, you've just delivered and you're recovering. Remember that it's a surgical procedure, so there is definitely pain. So take good, adequate painkillers so that you're comfortable. We usually give painkillers that can be taken 3 times a day, especially in the first week when the pain is more. Following the first week, the pain reduces and you're much more comfortable. So good painkillers is a must. Don't think that the more medications I take, it's going to affect the breast milk and it's not good for the baby. You must make sure you're comfortable. The second is the wound. You have to take good care of the wound. We normally discharge you with a waterproof dressing, so you can have normal regular bath on a regular basis, wash the wound really well and keep it clean. Next, coming to the activity. It is very, very important that you get adequate rest because you're healing and also you have to take care of another baby. So get adequate help from your near and dear ones, but at the same time, get adequate rest. Having said this, there's a myth where, mothers are not allowed outside the house or they're not allowed to even walk out of bed. So that should not be done because being mobile after a cesarean section is very important. It avoids the formation of blood clots in the legs. So you need to start taking short walks as and when possible. And after about 2 weeks, you can start going for a good 15-20 minute walk as well. Now coming to the diet. There are a lot of myths and a lot of restrictions on diet for a delivered mother. These restrictions, really do a lot of harm to the mother, particularly when they say you're not allowed to drink water. It's totally wrong and you have to drink at least 3 to 4 liters of water because drinking a lot of water avoids urinary tract infections. At the same time, it helps in the breast milk production. Now coming to the diet, there are a lot of restrictions, but you need to make sure you're eating enough proteins because proteins are necessary for your recovery. So having good amount of fruits and vegetables in your diet is very, very important. The next is lifting heavy weights. Yes, it is true that you should not be lifting too much of heavy weight in the first 6 weeks. You can lift something that's as heavy as your baby and anything lighter, but not anything very heavy. Finally, coming to the sexual activity, you can resume sexual activity after 6 weeks, but not before that. You need to have a checkup with us 1 week following your delivery where we have a look at the wound and where we discuss contraception, and also again at the end of 6 weeks when your body completely returns to its pre-pregnancy state. Apart from this, another common question that is asked to us is about the use of an abdominal binder, or people say, can we tie something around the abdomen? So yes, this can be done following delivery, but in the initial days you can wrap something around, not too snugly but gently. It provides support to the muscles and the back. So as days pass by, you can wrap it around more tightly. So initial days, use it when you're sitting and feeding the baby or when you're walking. It is not necessary to use this belt during the night time. Finally, there are a lot of mood changes that happen, and it's very, very important to acknowledge these mood changes. Speak to your husband, speak to the ones around you. If you're feeling too depressed or if you're not feeling okay, speak to them about your emotions and consult us or your gynecologist immediately in case you feel you're depressed, because the earlier it is addressed, the better it is for you and for your baby. In the end, I would like to say breastfeed your child and enjoy this phase. The breastfeeding really helps in bonding with the baby.